Hi, dear friends. So, on popular demand, I'm uploading this video with side pose of my hands while I'm operating this white cataract. This is Dr. Simanchal Goel, and on popular demand, here's a video with my side poses of my hand and wrist movements. So, I've started this case, and it's 1.25x of the normal speed, and as you can see, I'm a right handed surgeon. My dominant hand is my right hand, and new surgeons come to me and ask me how do I hold the instruments. The best way to hold the instruments is to stabilize the nozzle of your instrument or the syringe with your left hand, just like this, and use your right hand for the plunger, for injecting visco, for doing the rexes, for stabilizing the globe. Always use your left hand, just like this. I'm holding the limbs in my left hand, and I've started with the capsular rexes. It will be a CCC from a cystitome in one go. That is, in around 10 seconds, the CCC is over. And strategically, I have chosen the right eye of the patient, and I have told my OT assistant to record the video at an angle that shows you the wrist movements, the position of the fingers, how you stabilize your left hand with the supraorbital ridge of the patient, and 30 degrees up, and then parallel to the plane of iris, I have made this main port. My OT assistant continuously helps me in taking these instruments as I look around in the eyepiece of my operating microscope. I don't take my eyes off the operating microscope. My OT assistant is polished enough to hand me over the instruments that are required in the next step. I started with the phaco, and notice how I use my left hand and the chopper and subtle twisting movements of the left hand. You can also try to mimic my position of the right hand. Everyone's method of holding the phaco handpiece is different. Mine is the video that's going on. I have noticed it for the first time because reflexly you're so engrossed in the surgery you never notice the position of your hands. I hold my phaco handpiece in three fingers, as you can see, and most of the surgery is done by stabilizing your hands on the infraorbital and the supraorbital rim of the patient. That's the key take home message for newbie surgeons who struggle to find stability in their hand movements because their hands keep on floating above the eye. You don't have to float your hands above the eye. Take the support of the patient's skull and the bones of the patient, especially the supra and the infraorbital rim. My OT assistant continuously irrigates the corneal surface for maintaining the clarity. And yes, we are done with the phaco. Minimal cortex is left. It was a hard white cataract. And as you can see, I'm stabilizing the nozzle with the left hand and pushing the plunger with my right hand. And that is the end of the case. 90% of the case is gone, and now comes the bimanual. The trick to bimanual is I always put the irrigating on the right side in the first go, and I'm just twisting the aspiration cannula to clear the right hemicircle of the cortex, and then I'll switch the sides so that I can hydroimplant the IOL in one go. I don't have to take any of the cannulas out, thus thereby shortening my operative time. And in this case, it was around 5.5 minutes of operative time for a white cataract, which is pretty good. And yes, I have stabilized my irrigation cannula in my left hand, and from the right hand, I am just injecting the IOL straight in the bag. And once I have to position the trailing haptic, I grab hold of the aspiration cannula that was lying there on the sterile sheet. And yes, let's call it a day. I hope you like this different kind of video, which is not from the old operating microscope views, as you are as you see all the time. This is a side pose so that you learn something new, the movement of the wrists, the movement of the fingers, and how to hold the instruments. That's all. Thank you and have a nice day.